in.
Hi. How are you?
I'm fine.
My name is Inspector No Clasbi with the Clasbi unit. I've heard you guys have had some increase in some Clasbi cases, and I'm here to investigate that. Can you tell me a little bit more?
What is a Clasbi?
Stay tuned to find out. About the steps to take whenever you're going to be drawing blood from a central line. First things first is we need to gather our supplies. So I'm going to give you a list of supplies that you are going to need. First thing is you need to get a big plastic bag. This is going to serve later as a clean surface area for when you go in the patient's room. But for right now, we're going to place all of our supplies in this big bag. You are going to need to get 3 10 ml syringes of normal saline. You are going to need to get 6 site scrubs, a small plastic bag for your blood tubes, a luer lock access device, a luer lock cap, 2 6 ml vacuum containers for your waste straws. This will eventually change to 9 ml, so you just would need 1 instead of the 2 6. Your lab tubes, and patient labels. Hi, Miss No Clasbi. My name is Kristen Smith, and I'm going to be drawing you some blood from your central line. The first thing you're going to do is come into the patient's room, and you're either going to wash your hands or use the alcohol gel. Either one is appropriate. You will then take your big plastic bag full of supplies, and you will lay it on the patient's surface. Now this is going to serve for us a clean surface area. So what you're going to do is you're going to rip it from the side or tear it from the side so that it allows you to have this clean surface area. We are then going to put on our gloves. And we're going to pull out our patient labels to make sure that we have the correct patient. Can you please tell me your name and your birth date?
Bernice No Clasbi, 12/28/82.
Good deal. We've got the right patient. We've checked against our lab labels and we're ready to proceed. You will then walk over to where your central line is located. If they currently have IV fluids running, we are going to need to disconnect this. First of all, we're going to need to stop the pump. So after we stop the pump, we are going to disconnect the tubing from the hub, like so. You will then take your site scrub, open that, and we're going to scrub the top of the cap for 8 twist. You are then going to take your luer lock cap and we're going to cap this off. You now can take your tubing and hang it in a safe area. We're now going to take another side scrub and we're going to scrub the hub for 8 twists. We are now going to take one of our 10 cc syringes and we're going to flush with normal saline. Do not use this to draw back blood. This is just surely to flush. You will now use another side scrub and scrub the hub for another 8 twists. You are now going to use your luer lock access device. Open that and connect it to the hub. Maybe in a twisting-like motion. It's important for you to hold the hub and the luer lock at a 30-degree angle. We are now going to take our 2 white containers for our blood waste, which are 6 mLs. This is eventually going to be going away, and we are now going to have 9 mLs. At a 30-degree angle, I'm going to draw my waste. Now we're going to actually draw our labs. This is from order to draw, and if you were unfamiliar with your hospital's order to draw policy, please refer to draw our labs. We are now going to disconnect the luer lock from the hub. We are going to clean the site with the site scrub. Again for 8 twists. We will flush the line with 10 mLs of saline using a pulsating like motion. We will scrub the hub again with the site scrub for 8 twists. And flush again with the 10 cc's using a pulsating type motion. You will now scrub the hub again for 8 twists, this time leaving the cap on until we replace it back with IV fluid tubing. You will then uncap the IV fluid tubing. Take the site scrub off and connect the two. You can now restart your IV fluids. And we will now put the patient labels on the blood tubing. You'll peel these off and place as so. Once you've placed your lab labels on, you will take your small plastic bag and place the blood tubes in the bag. Now you're ready to send to lab. Hey everyone, it's Kristen Smith from Organizational Development. Today we're getting ready to go over the standard work that is needed to change a central line. Central line applies to any PICC lines or to any central line with a double, triple, or quad Lehman. To get started, we're going to talk about the supplies that are needed. You first need to have a pair of clean gloves, a central line dressing changing kit, and if you have a PICC line, you will also need to get a wing guard. The next steps will be in the patient's room. Hi, Ms. No Clasbi. My name is Kristen, and I'm going to be changing your central line. The first thing that you need to do is you need to clean your hands. Alcohol gel is appropriate. Once you have cleaned your hands, you need to don on clean gloves. Before we get started, it's very important that we are working off of a clean surface, so we do need to clean our surface. Once we have cleaned our surface, we can remove our gloves and rewash our hands. We need to identify our patient using the 2 identifiers by asking the patient's name and her birthday. Once we have identified that this is the correct patient, we can begin the steps needed to take to change the patient's central line. The first thing we're going to do is we're going to bring all the supplies here to our clean work area. After we have cleaned our surface, we do need to bring a trash can that is closest to us. This will ensure that all of our dirty supplies can go in the trash can without breaking sterile field. We supplies we need on our clean field. We have our central line dressing kit, we have our wing guard, and we have our clean gloves. So the first thing we're going to do is we're going to place on our clean gloves. In our central line dressing kit. We are going to open it from the very top, working our way to the bottom. It's very important to pay very closely attention to this step because this step is very crucial in maintaining sterile field. So we are going to open the package. The first thing we're going to do is we're going to actually remove the instructions. There is a list of instructions in case you forget how to change a central line. We are then going to place our mask . After placing the mask, we are now going to remove the drape that goes under the patient's arm. We will place the drape under the patient's arm where the central line is at, or the PICC line. Underneath the patient's arm where the PICC line is at, we are now ready to remove the old dressing. We are going to maintain stability with one hand while removing the old dressing with the other. We will peel back the old dressing and we will toss in the trash. At this point, we do need to inspect the site to make sure there is no signs of infection, any kind of redness or drainage. We also need to make sure that the site markings are exactly where the site markings were listed inside the chart to make sure it has not moved or slipped. Removing the dressing and inspecting the site, we are now ready to change the dressing. We must remove our gloves, clean our hands, and begin the process. After we have washed our hands, it is now time for us to begin the process. We are going to open our wing guard and place it in the sterile field. We are now going to remove our sterile gloves. We'll put on our sterile gloves. The first thing we're going to remove is our alcohol swab sticks. It is very important here to use one swab per swipe. For demonstration purposes, I will be trying to stabilize the PICC line here due to it being on a noodle. You're going to begin at the base here, and you're going to work yourself outwards. And remember, only one swab per swipe. Once we have swabbed with alcohol, we are going to take our HCG, ChloraPrep, and we're going to crack it till all of the solution gets to the bottom of the sponge. Now, this one is going to be used in a back and forth motion to clean the site. And we're going to throw away. Once you have done that, we are going to place our bio patch. The bio patch is blue, blue side to the sky. For central lines, the bio patch has a slit, and it may be placed downward. However, if it is a PICC line, the slit must be placed upward facing the patient. The next step, after placing the bio patch, after you place the bio patch, the next step will be to place the wing guard. The wing guard will be placed as so, interlocking the two loops here. Once it is locked in place, you will then take your dressing. The dressing has a center fold in it. The center is for where the bio patch should be placed. So as you peel that off, the center should go where the bio patch is located. You will then droop the tail upward through the slit. After that, you'll take the other piece of the dressing and interlock it. Once this is secured, you will then peel off the top sticker, date, time, and initial of the dressing change. After all is complete, remove gloves, goggles, and throw away all supplies. You will now wash your hands, and then it's time to document. Hey everybody, this is Kristen Smith from Organizational Development. This next little bit, we're going to talk about how to document. The first thing we're going to show you is how to document patient education. It's very important that we educate our patients on the Clasbi prevention as well as the CHG baths that we are giving them. If you're inside a patient record, as you see here, and you're on your correct patient, when you go under assessments, you're going to go to the education tab over your filtered list. You're going to open this up and you're going to scroll down to see education topic. When we go to education topic, you'll click on the little double check boxes that are here. And we're just going to scroll till we find the CHG bath and then the Clasbi prevention. Now, if you give them any kind of books or handouts or any kind of pamphlets, you can also document that here under the comments section. Now, once you give your patient a CHG bath, you can actually document this under the ADL flow sheet. So we're going to go under the ADL flow sheet under the filtered list. And we're going to scroll down. Always make sure you put the right time and date that you did this. Under personal care, there's a bath or shower. There is the CHG bath that was given. So this is where you're going to go to document that. Now make sure you save that, obviously. Now that you did your central line dressing change, you do need to go in and document that as well. So I'm going to go down here to my central line. So if it was a PICC, I would go to my PICC flow sheet. And you'll find the one that is filled out here. And we're going to scroll on down. And we're going to go to where it says IV interventions. Under IV interventions, you can do dressing changed or flushed or whichever thing that you did. Okay. Once you document that, you're good to go. If you guys have any questions, contact us here in OD. Thank you.